What is pharmacoeconomics? A. The study of the economic aspects of pharmacy practice. B. The study of the costs and outcomes of drug therapy. C. The study of pharmaceutical marketing strategies. D. The study of drug manufacturing processes. The correct answer is B. Pharmacoeconomics is the study of the costs and outcomes of drug therapy. Which of the following is not a common pharmacoeconomic evaluation method? A. Cost minimization analysis. B. Cost effectiveness analysis. C. Cost paralysis analysis. D. Cost utility analysis. The correct answer is C. Cost paralysis analysis is not a common pharmacoeconomic evaluation method. What does a cost effectiveness analysis measure? A. The cost of achieving a desired outcome. B. The cost per quality adjusted life year gained. C. The cost of manufacturing a drug. D. The marketing costs of a pharmaceutical company. The correct answer is A. A cost effectiveness analysis measures the cost of achieving a desired outcome. Which of the following is a component of pharmacoeconomic analysis? A. Efficacy. B. Safety. C. Cost. D. All of the above. The correct answer is D. All of the above are components of pharmacoeconomic analysis. What does ICER stand for in pharmacoeconomics? A. Intermittent cost effectiveness ratio. B. Incremental cost effectiveness ratio. C. Internal consistency evaluation ratio. D. Innovative cost effectiveness research. The correct answer is B. Less than break time equals 1s greater than. ICER stands for incremental cost effectiveness ratio. What is a quality adjusted life year, or QALY, used to measure in pharmacoeconomics? A. The quality of life of a patient after drug therapy. B. The cost effectiveness of a drug therapy based on outcomes. C. The total cost of a drug therapy. D. The efficacy of a drug therapy. The correct answer is A. A quality adjusted life year, or QALY, measures the quality of life for a patient after drug therapy. Which of the following is a limitation of pharmacoeconomic analysis? A. It does not consider patient preferences. B. It does not consider clinical trial results. C. It does not consider cost savings. D. It does not consider safety outcomes. The correct answer is A. A limitation of pharmacoeconomic analysis is that it does not consider patient preferences. What does a sensitivity analysis assess in pharmacoeconomics? A. The effect of varying input parameters on the results of an economic evaluation. B. The sensitivity of drug molecules to certain patients. C. The safety profile of a drug therapy. D. The cost of hospitalization for patients. The correct answer is A. A sensitivity analysis assesses the effect of varying input parameters on the results of an economic evaluation. What is willingness to pay, or WTP, in pharmacoeconomics? A. The amount of money a patient is willing to pay for drug therapy. B. The cost of marketing a new drug. C. The regulatory standards for drug pricing. D. The reimbursement rates for pharmacies. The correct answer is A. Willingness to pay, or WTP, in pharmacoeconomics refers to the amount of money a patient is willing to pay for drug therapy. Which of the following is a type of pharmacoeconomic evaluation method? A. Cost minimization analysis. B. Therapeutic drug monitoring. C. Pharmacovigilance. D. Meta-analysis. The correct answer is A. Cost minimization analysis is one of the types of pharmacoeconomic evaluation methods that compare different options with similar outcomes to find the cheapest alternative. What is the primary focus of a cost-benefit analysis in pharmacoeconomics? A. Costs associated with adverse events. B. Value of the benefits compared to the costs. C. Costs of drug production. D. Economic burden on healthcare systems. The correct answer is B. A cost-benefit analysis in pharmacoeconomics focuses on comparing the value of a treatment's benefits to its costs. Which of the following is considered an indirect cost in pharmacoeconomics? A. Cost of medication. B. Patient transportation to healthcare facilities. C. Physician consultation fees. D. Hospital bed charges. The correct answer is B. Patient transportation to healthcare facilities is an indirect cost in pharmacoeconomics. It's an additional cost not directly related to the treatment itself. How is cost-utility analysis different from cost-effectiveness analysis in pharmacoeconomics? A. Cost-utility analysis focuses on the monetary value of benefits, while cost-effectiveness analysis compares different treatments directly. B. Cost-effectiveness analysis considers quality of life measures, while cost-utility analysis only looks at costs. C. Cost-utility analysis compares treatments with similar outcomes, while cost-effectiveness analysis considers patient preferences. D. Cost-effectiveness analysis measures healthcare utilization, while cost-utility analysis assesses resource allocation. The correct answer is C. Cost-utility analysis compares treatments with similar outcomes in terms of cost per unit of health outcome, usually quality-adjusted life years, or QALYS. Cost-effectiveness analysis compares different treatments directly. In pharmacoeconomics, what's the aim of a budget impact analysis? A. To determine the total cost of a treatment compared to its benefits. B. To assess the financial impact of adopting a new treatment within a specific budget. C. To calculate the cost per unit of health outcome for different treatments. D. To compare the cost effectiveness of various treatments. The correct answer is B. The aim of a budget impact analysis in pharmacoeconomics is to assess the financial impact of adopting a new treatment within a specific budget, helping decision makers understand the budgetary consequences of their choices. Which of the following best describes the concept of cost of illness analysis in pharmacoeconomics? A. Assessing the financial burden of healthcare on individuals. B. Calculating the total costs associated with a specific disease or health condition. C. Evaluating the cost effectiveness of different healthcare interventions. D. Estimating the economic impact of adverse drug reactions. The correct answer is B. Cost of illness analysis in pharmacoeconomics involves calculating the total costs associated with a specific disease or health condition, including direct and indirect costs. What aspect of pharmacoeconomic analysis does a sensitivity analysis help to assess? A. Estimation of probabilities for decision making. B. Variability and uncertainty in key parameters. C. Patient preferences for different treatments. D. Cost effectiveness threshold values. The correct answer is B. A sensitivity analysis in pharmacoeconomic analysis helps assess the variability and uncertainty in key parameters, providing insights into the robustness of the conclusions. Which of the following factors can influence the generalizability of pharmacoeconomic study results? A. Study design. B. Patient demographics. C. Healthcare system differences. D. All of the above. The correct answer is D. All of the above factors, study design, patient demographics, and healthcare system differences, can influence the generalizability of pharmacoeconomic study results. What does pharmacoeconomic research aim to achieve in healthcare decision-making? A. Minimize costs while achieving optimal health outcomes. B. Maximize profits for pharmaceutical companies. C. Promote the use of expensive treatments. D. Reduce patient access to essential medications. The correct answer is A. Pharmacoeconomic research aims to identify and compare cost-effective healthcare interventions. These interventions minimize costs while achieving optimal health outcomes. This research guides decision-making in resource allocation. How does a willingness to pay threshold influence pharmacoeconomic decision-making? A. It determines the maximum cost a society is willing to pay for a health benefit. B. It sets a minimum threshold for drug pricing. C. It calculates the cost-effectiveness ratio of a treatment. D. It estimates the economic burden of a disease. The correct answer is A. A willingness to pay threshold in pharmacoeconomics helps determine the maximum cost a society is willing to pay for a health benefit, assisting in decision-making regarding the value of healthcare interventions. What is the opportunity cost of a pharmacoeconomic decision? A. The cost of choosing one treatment option over another. B. The total cost of healthcare in a given year. C. The cost of conducting a pharmacoeconomic study. D. The cost of healthcare services. The correct answer is A. The opportunity cost of a pharmacoeconomic decision refers to the cost of choosing one treatment option over another, considering what is given up by choosing that option. Which of the following is true about cost minimization analysis in pharmacoeconomics? A. It compares the costs of different treatment options while considering their outcomes. B. It evaluates the cost effectiveness of interventions based on their clinical benefits. C. It assumes treatment options have equal efficacy and safety. D. It measures the cost of implementing new healthcare technologies. The correct answer is C. Cost minimization analysis in pharmacoeconomics compares the costs of different treatment options, assuming equal efficacy and safety. What is the role of a decision tree in pharmacoeconomic analysis? A. To quantify the effectiveness of healthcare interventions. B. To display the possible outcomes of different treatment choices. C. To calculate the budget impact of a new drug. D. To assess the willingness to pay threshold in pharmacoeconomics. The correct answer is B. A decision tree in pharmacoeconomic analysis displays possible outcomes of different treatment choices. It helps analyze the costs and consequences of each option. Which of the following best describes the concept of cost-effectiveness ratio? A. The total cost of a treatment divided by the number of patients treated. B. The ratio of the costs of two treatment options to their differences in outcomes. C. The incremental cost divided by the incremental effectiveness of a new treatment compared to a standard. D. The measure of cost per quality adjusted life year gained from a specific intervention. The correct answer is C. Cost-effectiveness ratio is calculated as the incremental cost divided by the incremental effectiveness of a new treatment compared to a standard treatment. This allows for comparison of cost-effectiveness between different interventions. How does discounting play a role in pharmacoeconomic evaluations? A. It adjusts costs and outcomes to their present value for accurate comparisons over time. B. It increases the original costs of healthcare interventions for budget impact analyses. C. It declines the willingness to pay threshold for cost-effectiveness calculations. D. It minimizes the relevance of long-term healthcare outcomes in pharmacoeconomic studies. The correct answer is A. Discounting in pharmacoeconomic evaluations adjusts costs and outcomes to their present value, allowing for accurate comparisons over time by considering the time value of money. What does a net monetary benefit, or NMB, analysis measure in pharmacoeconomics? A. The economic utility of a healthcare intervention compared to alternatives. B. The total healthcare expenditures in a given population. C. The overall cost effectiveness of a specific treatment compared to others. D. The willingness to pay threshold for a new drug or therapy. The correct answer is A. Net monetary benefit, or NMB, analysis in pharmacoeconomics measures the economic value of a healthcare intervention by comparing it to other options, considering both costs and outcomes. Which of the following is an advantage of using quality-adjusted life years, or QALYs, in pharmacoeconomic evaluations? A. They offer a single, standardized measure of health outcomes across different interventions. B. They focus solely on the economic costs of healthcare treatments. C. They are insensitive to patient preferences and quality of life improvements. D. They only consider the clinical efficacy of interventions. The correct answer is A. Using quality-adjusted life years, or QALYs, in pharmacoeconomic evaluations provides a standardized measure of health outcomes. This allows comparisons across different interventions based on both the quantity and quality of life gains. What does a value of information analysis, or VOI analysis, assess in pharmacoeconomics? A. The impact of different discount rates on cost-effectiveness results. B. The additional benefit of collecting more data to reduce decision uncertainty. C. The relationship between indirect and direct costs in healthcare expenditures. D. The willingness to pay threshold for novel treatments or technologies. The correct answer is B. A value of information analysis, or VOI, in pharmacoeconomics assesses the extra benefit of getting more data to reduce uncertainty. This helps decision makers figure out if more research or data collection is worthwhile. How can real-world evidence, or RWE, influence pharmacoeconomic evaluations? A. By providing data on real-world clinical and economic outcomes of healthcare interventions. B. By potentially increasing the cost-effectiveness of interventions through RWE analysis. C. By potentially lessening the reliance on clinical trials in cost-benefit analyses. D. By not excluding, but rather potentially including, patient preferences and quality of life considerations in economic evaluations. The correct answer is A. Real-world evidence, or RWE, can influence pharmacoeconomic evaluations. It provides data on actual clinical and economic outcomes of healthcare interventions, as seen in routine practice. This enhances the relevance and generalizability of study results. What term describes comparing the costs and consequences of different drug treatments? A. Cost-benefit analysis. B. Pharmacokinetics. C. Pharmacodynamics. D. Pharmacoeconomics. The correct answer is D. Pharmacoeconomics involves comparing the costs and consequences of different drug therapies to inform decision-making. Which of the following is a common outcome measure used in pharmacoeconomic evaluations to assess health outcomes and quality of life? A. Cost minimization analysis. B. Net monetary benefit, NMB. C. Quality adjusted life year, QALY. D. Decision tree analysis. The correct answer is C. A quality adjusted life year, or QALY, is a common measure in pharmacoeconomic evaluations. It combines both the quantity and quality of life. What aspect of pharmacoeconomic analysis does a cost-consequence analysis primarily focus on? A. Efficacy outcomes only. B. Cost outcomes only. C. Both costs and consequences separately. D. Quality of life outcomes only. The correct answer is C. A cost-consequence analysis focuses on presenting both costs and consequences of different interventions separately, without aggregating them into a single measure. Which of the following is a potential limitation of using real-world evidence, or RWE, in pharmacoeconomic evaluations? A. Lack of generalizability to specific patient populations. B. Increased accuracy and precision of results. C. Reduction in decision uncertainty. D. Improved reliability in cost-effectiveness assessments. The correct answer is A. One limitation of using real-world evidence is the potential lack of generalizability to specific patient populations seen in controlled clinical trials. What is the primary focus of a value of information analysis, or VAI, in pharmacoeconomics? A. Assessing cost-effectiveness ratios. B. Determining budget impact. C. Evaluating uncertainty surrounding decisions. D. Measuring willingness to pay thresholds. The correct answer is C. Value of information, or VAI, analysis focuses on evaluating uncertainty in decision-making and determining the value of getting more information. Which of the following is considered an indirect cost in pharmacoeconomics? A. Cost of medication. B. Loss of productivity due to illness. C. Hospitalization expenses. D. Physician consultation fees. The correct answer is B. Loss of productivity due to illness is an indirect cost in pharmacoeconomics. It reflects how a medical condition affects a person's work and income. What does a net monetary benefit, or NMB, analysis measure in pharmacoeconomics? A. Cost-effectiveness ratios. B. Opportunity costs. C. Monetary value of outcomes above a monetary threshold. D. Patient preferences for specific drug therapies. The correct answer is C. Net monetary benefit, or NMB, analysis measures the monetary value of outcomes above a specified threshold. This helps decision makers assess the value of different interventions. In pharmacoeconomics, how does discounting affect the evaluation of intervention costs and outcomes over time? A. It adjusts for inflation rates. B. It considers the present value of future costs and outcomes. C. It standardizes utility values. D. It calculates the cost-effectiveness ratio. The correct answer is B. Discounting is used in pharmacoeconomic evaluations to consider the present value of future costs and outcomes, accounting for the time value of money. What term describes measuring all the costs and outcomes of different medical treatments? A. Cost minimization analysis. B. Cost effectiveness ratio. C. Cost consequence analysis. D. Value of information analysis. The correct answer is C. Cost consequence analysis involves measuring the full range of costs and outcomes associated with different interventions, presenting them separately without aggregation. Which of the following best describes the aim of a budget impact analysis in pharmacoeconomics? A. To assess the cost effectiveness of new drugs. B. To estimate the financial consequences of adopting new drugs. C. To determine willingness to pay thresholds. D. To evaluate the opportunity costs of healthcare decisions. The correct answer is B. A budget impact analysis estimates the financial consequences of adopting new drugs or interventions in healthcare. It helps decision makers understand the budgetary implications. What is the primary focus of a cost-benefit analysis in pharmacoeconomics? A. Comparing costs of different interventions. B. Evaluating the cost and health benefits of interventions. C. Calculating return on investment for pharmaceutical products. D. Assessing indirect costs associated with healthcare decisions. The correct answer is B. A cost-benefit analysis in pharmacoeconomics aims to evaluate the costs and health benefits of different interventions to determine if the benefits outweigh the costs. How does discounting play a role in pharmacoeconomic evaluations? It adjusts future costs and outcomes to their present value. It compares the costs of different interventions over time. It assesses the indirect costs associated with healthcare decisions. It measures the quality-adjusted life years, or QALYS, gained from interventions. The correct answer is A. Discounting in pharmacoeconomic evaluations adjusts future costs and outcomes to their present value, taking into account the time value of money. What does a net monetary benefit, or NMB, analysis measure in pharmacoeconomics? A. Costs of healthcare interventions. B. Monetary value of health outcomes. C. Indirect costs associated with interventions. D. Net benefit of an intervention in monetary terms. The correct answer is D. A net monetary benefit, or NMB, analysis in pharmacoeconomics measures the net benefit of an intervention in monetary terms, considering both costs and outcomes. How can real-world evidence, or RWE, influence pharmacoeconomic evaluations? A. By providing insights into the hypothetical outcomes of interventions. B. By offering real-world data on the costs and outcomes of interventions. C. By assessing the long-term effectiveness of pharmaceutical products. D. By focusing on theoretical models of cost-effectiveness analyses. The correct answer is B. Real-world evidence, or RWE, can influence pharmacoeconomic evaluations by providing actual data on the costs and outcomes of interventions in real-world settings. Which of the following best describes the concept of cost-effectiveness ratio? A. The total cost of an intervention. B. The ratio of costs to health benefits of an intervention. C. The indirect costs associated with healthcare decisions. D. The opportunity cost of a pharmacoeconomic decision. The correct answer is B. A cost-effectiveness ratio in pharmacoeconomics represents the ratio of costs to health benefits gained from an intervention, providing a measure of cost-effectiveness. What is the purpose of a cost-consequence analysis in pharmacoeconomics? A. To assess the monetary value of health outcomes. B. To compare costs of different healthcare interventions. C. To focus on the full range of costs and outcomes associated with interventions. D. To calculate the net monetary benefit, or NMB, of interventions. The correct answer is C. A cost-consequence analysis in pharmacoeconomics focuses on the full range of costs and outcomes associated with different interventions, providing a comprehensive overview of consequences. What does a value of information analysis, or VOI analysis, assess in pharmacoeconomics? A. The discount rate applied to costs and outcomes. B. The willingness to pay threshold for interventions. C. The net monetary benefit, or NMB, of interventions. D. The potential value of collecting additional information for decision-making. The correct answer is D. A value of information, VOI, analysis in pharmacoeconomics assesses the potential value of collecting additional information to support decision-making processes. Which of the following factors can influence the generalizability of pharmacoeconomic study results? A. The type of sensitivity analysis conducted. B. The source of real-world evidence utilized. C. The discount rate applied to costs and outcomes. D. The specific patient population and setting considered. The correct answer is D. The generalizability of pharmacoeconomic study results can be influenced by factors such as the specific patient population and setting. This affects how findings can be applied to broader contexts. What term describes comparing the costs and consequences of different drug treatments? A. Sensitivity analysis. B. Real-world evidence, or RWE. C. Cost-consequence analysis. D. Cost minimization analysis. The correct answer is D. The comparison of the costs and consequences of alternative drug therapies is described by the term cost minimization analysis in pharmacoeconomics. It focuses on identifying the least costly option among treatments with equivalent outcomes. What is the role of a decision tree in pharmacoeconomic analysis? A. To compare the costs and benefits of interventions over time. B. To calculate the net monetary benefit of interventions. C. To quantify the value of information in decision-making. D. To model the potential outcomes and costs associated with different choices. The correct answer is D. A decision tree in pharmacoeconomic analysis models potential outcomes and costs of different choices. It helps illustrate decision pathways and their consequences. Which term describes measuring the full range of costs and outcomes of different healthcare interventions? A. Cost-effectiveness ratio. B. Cost-consequence analysis. C. Budget impact analysis. D. Value of information analysis. The correct answer is B. Cost-consequence analysis focuses on measuring the full range of costs and outcomes associated with different interventions. What is the primary focus of a value of information analysis, or VOI analysis, in pharmacoeconomics? A. Assessing indirect costs. B. Evaluating discounting methods. C. Measuring the full range of costs and outcomes. D. Assessing the value of reducing uncertainty in decision-making. The correct answer is D. The primary focus of a value of information analysis is to assess the value of reducing uncertainty in decision-making. How can real-world evidence, or RWE, influence pharmacoeconomic evaluations? A. By providing hypothetical scenarios. B. By increasing the generalizability of study results. C. By focusing on direct costs only. D. By excluding indirect costs from analysis. The correct answer is B. Real-world evidence can influence pharmacoeconomic evaluations by increasing the generalizability of study results. What term describes comparing the costs and consequences of different drug treatments in pharmacoeconomics? A. Cost minimization analysis. B. Cost consequence analysis. C. Cost effectiveness ratio. D. Budget impact analysis. The correct answer is A. Cost minimization analysis involves comparing the costs and consequences of alternative drug therapies. Which of the following is a potential limitation of using real-world evidence, or RWE, in pharmacoeconomic evaluations? A. Increased generalizability of study results. B. Difficulty in obtaining specific cost data. C. Underestimating the true cost of interventions. D. Limited control over confounding variables. The correct answer is D. A potential limitation of using real-world evidence in pharmacoeconomic evaluations is the limited control over confounding variables.